ServSafe CH for exam questions. Proper hand washing procedure. 5. 1. Wet your hands and arms with running water as hot as you can comfortably stand, at least 100 degrees Fahrenheit. 2. Apply soap. 3. Scrub hands and arms vigorously for 10 to 15 seconds. 4. Rinse hands and arms thoroughly under running water. 5. Dry hands and arms with a single-use paper towel or hand dryer. Components of a good personal hygiene program. 6. 1. Following hygienic hand practices. 2. Maintaining personal cleanliness. 3. Wearing clean and appropriate uniforms and following dress codes. 4. Avoiding certain habits and actions. 5. Maintaining good health. 6. Reporting illness. Food handlers can contaminate food when they 5. 1. Have a foodborne illness. 2. Have wounds that contain a pathogen. 3. Have contact with a person who is ill. 4. Touch anything that may contaminate their hands and don't wash them. 5. Have symptoms such as diarrhea, vomiting, or jaundice. Hand care for food handlers. 3. 1. Keep fingernails short and clean. 2. Do not wear false nails or nail polish. 3. Bandage wounds and cover bandages. Situations when a food handler should be excluded from working around food, regular operation. 1. When food handler has one or more of these symptoms, vomiting, diarrhea, jaundice. 2. When food handler has been diagnosed with a foodborne illness caused by one of these pathogens, Salmonella typhi, Shigella spp, Shiga toxin-producing E. coli, hepatitis A, norovirus. Disease not transmitted through food. 4. 1. AIDS. 2. Hepatitis B. 3. Hepatitis C. 4. Tuberculosis. Hand antiseptics must. 3. 1. Comply with FDA standards. 2. Never be used in place of hand washing. 3. Be allowed to dry before touching food or equipment. Activities not allowed in food prep areas. 6. 1. Eating. 2. Drinking, unless using a straw in covered container. 3. Chewing gum. 4. Chewing tobacco. 5. Smoking. 6. Spitting. Method of properly tasting food during preparation. Place in a separate dish and taste with a clean utensil, which should then be removed from the prep area and cleaned. Single-use gloves used for handling food. Sad face. 3. 1. Must never be used in place of hand washing. 2. Must never be washed and reused. 3. Must fit properly. When to change gloves. 4. 1. As soon as they become spoiled or torn. 2. Before beginning a different task. 3. At least every 4 hours during continual use and more often if necessary. 4. After handling raw meat, seafood, or poultry and before handling ready-to-eat food. Carriers. People food carry pathogens and infest others without ever getting sick themselves. Proper work attire for food handler. 3. 1. Clean hat or hair restraint. 2. Clean aprons, chef coats, and uniforms. 3. No jewelry other than a plain wedding band. When food handlers should be restricted from working around food. Food handler has a sore throat and fever. With bare hand contact on ready-to-eat foods, some jurisdictions allow it but required. Sad face. 2. 1. Policies on employee health. 2. Training in hand washing and personal hygiene practices. Situation when a food handler should be excluded from working around food in establishments serve high-risk populations. When food handlers has a sore throat with fever. Role of management in a personal hygiene program. 5. 1. Establishing proper personal hygiene policy. 2. Training food handlers on personal hygiene policies and retraining them when necessary. 3. Modeling proper behavior for food handlers at all times. 4. Supervising food safety practices continuously and retraining food handlers as necessary. 5. Revising policies when laws and regulations change and when changes are recognized in the science of food safety.